Hi Evelyn, sorry for the delay in response. I think all I was going to say was I was going to talk about the upper bit of the thoracic spine. Out of everything that we talked about, if I had to narrow it down to one tiny little thing, which in a sense doesn't really require assessment, because if I was to say mobilise that area, that would be extremely unlikely to do any kind of harm at all, and it's probably most likely it would be the first thing that I'd look at if I saw you. Unfortunately, it's I think the area of the human body which is the most difficult for you to mobilise yourself. Like if you've got a wrist or something, it's very easy to move that. Your lumbar back, even though you can't get your hands on it, there are loads of twists and this, that and the other that you can do that, as you know, with your back pain, lots of things do affect that area. This part of the back, it's designed to be stiff. Your ribs are meant to stay where they are, so when you breathe, your lungs don't just collapse in. It's a difficult area to mobilise. There are a couple of things that you can do, but it's one of the few things that when it is really, really, really stiff, I usually feel that I need to actually see people in clinic, and it's relatively straightforward. You don't have to be too clever with it. You just lie people down on the front and find the area of the spine which is stiff and just repeatedly press into it from a variety of different angles, but that's really difficult to do yourself. There are a couple of things that you can do. The most obvious one is just a stretch back over a chair. So if you have, be very careful with your lower back and don't do anything that hurts your lower back. It's not meant to hurt your lower back. If you slide forwards, obviously the chair is going to be slightly further up your back, whereas if you just sit really far back, then it's going to be lower down. You want to get it to quite high up. It's going to feel as though it's not doing much. It's also around about where your shoulder blades are, so you need, if possible, to try and get your shoulder blades out of the way. But this movement is just trying to get your back to bend a little bit, but in this area, sort of a bit above bra level, where it doesn't want to bend much. You very possibly do this already, even if you don't do it for your back. Most people kind of do it if they sit for work, but you don't have a backrest for your chair at work, so maybe, I don't know. But if you put your hands behind your head, because you don't want your neck to loll back, and then you can sort of reasonably relax. That also brings your shoulder blades a little bit out of the way, so you can feel your spine is actually on this part of the chair, and then just it should feel quite stiff, and it will almost certainly feel like it's not doing very much. Try doing it in a few different places. The higher up your back you'll go, the less effective it will become. That's one thing you can try. Another thing that you can try is just putting your arms behind the chair, finding some way to grip with your arms, and then again just attempt somehow to pull this area of your back a little bit, or again just trying to get some weight onto it. It's a hard one to do. You can do rotations with a little bit of side flexion in it. If you twist your whole spine, obviously you're going to feel that mostly down in your lower back, which you don't want to do. But what you will find is if you twist and you also bend slightly to one side or to the other, it's quite easy to feel a stretch somewhere in the rib area. That's not a difficult thing to achieve. If you manage to feel a stretch in the rib area, just by slightly altering the angle, you can almost try and chase it up your back into that area we're talking about. You'll probably find that the sense of stretch as you get closer and closer to that area actually disappears a little bit, because it's a bit of a dead area. But you can try doing that. But again, it's better than nothing, but it doesn't do a right huge amount. One that sometimes does work, if you get any kind of object. For example, I've got here a rolled up pair of socks. And you put it on your spine, and you then lie down on it, and it should feel quite uncomfortable. If you then again support your head with your hands and you just almost try and let your body relax onto it as much as you can. Again, if this gives you any issue with your lower back, which it shouldn't, you can have your legs straight or bent over, it doesn't matter, then don't do anything that gives you problems with your lower back. But if you find that you can get this into a half decent place actually on your spine, when you lie on it, it really will feel quite uncomfortable. This is different to when we were arching back over the chair. That was actually making your spine curve. This shouldn't really be making your spine curve. It should just feel like someone's got a knuckle in your back, actually on the vertebra, and it'll be really quite uncomfortable. And you just want to relax as best you can, into it. Ugh. It'll feel a little bit like it's going to leave you with some kind of bruise or something like that. That's another one to try potentially. But these are all poor substitutes for, like I said before, actually having someone sort of look at it. Sorry, make you see it kind of wobble. You're good with your neck posture. I would also suggest just doing, when you do your neck posture, some reasonably over the top shoulder retractions. You don't need to worry about, in terms of using your spine and ribs, pushing your chest out. It's just shoulder retraction will naturally give a little bit of a stretch around at the front, and it will increase excuse me, a little bit of activity in and around in between your shoulder blades. That's by the by. I don't know, you might have really good activity sort of around your scapulae, I'm not sure. But yeah, it's a really difficult area to mobilise, but if you can find something that just feels like you're doing it, I think the socks one is probably the best, because that's the closest thing to someone effectively pushing into your spine, which is, I can't say it's what you need because I haven't felt your spine, but in your case I would be very surprised if someone was to actually have a push of your back. My guess would be that it would be either stiff or stiff and painful, possibly painful but not stiff. That would be unlikely, but yeah, nine times out of 10. I can't say this for certain because I don't know, but I would hazard a guess that that area would probably benefit from just being mobilised. If it hurts in that area when you're doing it, I mean within reason, not a problem. If it hurts a little bit afterwards, as long as it's not giving you too much jip, then yeah, I would suggest keep going with it. I still haven't got any tape videos, but you'd probably need to, well, I don't know, I was going to say you'd probably need to be shown those before you could do them, but if you saw them on a video, it may very well be that, yeah, if your husband did it, if it felt helpful, then great. But yeah, I'll see if I can track down one of my ex-colleagues and get them to send something in. But in the meantime, if you can just free that area up somehow in the top of your back, that's probably about the only thing that I would be able from a distance to say, oh yeah, you know, definitely try this, because everything else, it just all depends. But anyway, sorry it's been such a long time coming. I think I said to you already, I thought, oh yeah, I'll do it on retreat, that would be an appropriate place to do it, and then your mind goes somewhere else and it's all very busy. And then on the way home I had a near miss with COVID, and got back into the house a few days back and just completely forgot to send you the video, so sorry about that. Anyway, yeah, take care. Any questions, feel free to ask, but yeah, I hope things are going okay, and speak to you soon. Okay, cheers then, bye.